Joining us today, this media briefing is taking place at the Wisconsin Department of Military Affairs, where staff from multiple state agencies have been working out of the State Emergency Operations Center on the ongoing response to COVID-19. This briefing is also streaming live on the Department of Health Services YouTube channel. Joining us today are Major General Paul Knapp, Wisconsin's Adjutant General, and Department of Health Services Deputy Secretary Julie Willems Van Dijk. They will be providing an update on the important work that continues to take place at the SEOC. After some brief opening remarks, we will open the line to questions from reporters in the order in which their RSVP was received. We will go first to Major General Paul Knapp, Wisconsin's Adjutant General.
Good afternoon, ladies and gentlemen. I'm Major General Paul Knapp, and I'm Wisconsin's Adjutant General. I'm honored to join you today to give you a brief update on the Wisconsin National Guard, as well as the work of the Emergency Management and the State Emergency Operations Center as we continue to respond to the COVID-19 pandemic. Our citizen soldiers and airmen in the Wisconsin National Guard remain heavily engaged in the state's response to COVID-19. These troops continue to perform a variety of missions. And while the 25 teams assisting local communities statewide at specimen collection sites are what most members of the public might be familiar with, those teams only represent about half of the 1,400 Guard members currently supporting our missions. In addition to our specimen collection team, our troops are fulfilling a variety of other roles, ranging from providing medical monitoring and administrative support at 3 separate self-isolation facilities in Milwaukee and Madison, to supporting warehousing operations moving critical PPE around the state. We're also staffing a statewide call center to help contact residents with their COVID-19 testing results. Additionally, we're transporting test kits, and a mortuary affairs team is assisting the Dane County Medical Examiner's Office with surge requirements due to COVID-19. It takes hundreds of Guard members working diligently behind the scenes to manage this effort and collaborate with our partners across the state and in local communities. We will be here as long as needed to assist our fellow citizens across Wisconsin. This is who we are and what we do in the Wisconsin National Guard. We signed up and wear the uniform because we want to serve our state, our nation, and in this case, our own communities across Wisconsin. I'm incredibly proud of all our men and women who continue to selflessly answer the call, no matter what their mission. The same should be said for the men and women of Wisconsin Emergency Management and all the other people from state agencies working tirelessly in the State Emergency Operations Center to help us get to the other side of this pandemic. Their jobs are often thankless, their efforts often unseen and unheralded, but they're putting in long hours behind the scenes to manage requests for assistance and bring key people together to ensure resources flow to where they're needed the most. It's a monumental team effort across the board, and one that our entire state should be proud of. Thank you for this time this afternoon, and I look forward to answering your questions.
Thank you. We will now hear remarks from DHS Deputy Secretary Julie Willems Van Dijk.
Good afternoon, and thank you for joining us today. As communities across Wisconsin open up, we all need to work together to contain the spread of the COVID-19 virus. Here at the State Emergency Operations Center, we continue to do the work required to keep Wisconsinites safe. We continue to build our testing capacity and ensure our labs are well supplied. We continue to partner with the Wisconsin National Guard to stand up testing sites across the state. We continue to work with local health departments to expand contact tracing. And we need your help. If you are experiencing symptoms or have been exposed to COVID-19, we need you to stay home and call your healthcare provider and ask for a test. We also have information about community testing sites on our website, dhs.wisconsin.gov/testing. I know I've said this before, but as a reminder, the symptoms to watch for are a fever of over 100.4 degrees, cough, shortness of breath or difficulty breathing, a sore throat, a headache, chills, muscle aches, and or a new loss of taste or smell. And we need you to answer your phone if a contact tracer calls you. Following up with individuals who have tested positive for COVID-19 and then in turn following up with the people they've been in contact with is all integral work to boxing in the virus. Thank you for taking their call and following their instructions to stay home if you have COVID-19 or have been exposed. This is what we all need to do to stop the spread of this disease. And we also care about your mental and emotional health. This is a stressful time for all of us, and if you are looking for help dealing with that stress, we have added more tools to resilient.wisconsin.gov. Some of the new resources are specifically designed to help our frontline workers. We know stress and risk have always been a part of your jobs in healthcare or as first responders, but we also know COVID-19 compounds that stress and risk. Our communities need you, and we are so thankful for your work. And we also need to make sure you are healthy. So please connect with your loved ones and your colleagues, celebrate each other's successes, and take moments to share your sorrows. And remember, it's okay to ask for help. Our work at the SEOC is meant to keep Wisconsin safe and healthy. You are part of that work too. Please remember to get tested and stay home if you have symptoms, to practice physical distancing, to keep your social circles small and limit trips outside your home, to wear a face mask when you do leave your home, to wash your hands and don't touch your face, and to reach out for help if you need it.
Thank you. At this time, we will open the line to questions. Reporters will be called on in the order in which their RSVP was received. In the interest of time, we will be taking one question per outlet. All lines are currently in listen-only mode. Once called on, reporters should dial *6 to unmute their lines. Once you've asked your question, we ask that you please remute your line using *6 again. We will begin with Abigail Hankey from NBC 26.
Sorry, I was getting confused. Anyways, I have a question. Just in regards to how many cases the state is seeing, if people thought they had allergies, is that something you guys are seeing?
Well, clearly the symptoms of seasonal allergies can be similar to the symptoms of COVID-19. And so we're not tracking that, but I'm certain that many people who have negative tests may have come and gotten a test because they had a sore throat from their seasonal allergies or some other symptom. But really, we'd rather have you come in, even with mild symptoms, thinking it's seasonal allergies, and be tested so we can take appropriate action if it truly is COVID-19 and not just the usual spring hay fever.
Thank you. We'll go next to Sean Kirkby with Wisconsin Health News.
Hi, thanks for doing that. I was wondering, last week Governor Tony Evers announced that a plan to spend $1 billion to fight COVID-19, and there was a reference to New York State analytic software for the state's contact tracing program. Can you elaborate on what that software is and what it will allow the DHS to do that it hasn't done before? Thank you.
Sure. The software program that we are implementing will allow us to collect much of the information that we do right now, either through interview, through the ability of people who are being tested to upload their own information, and for us to connect that information directly into our disease surveillance software program. So a big piece of the advantage of this is it will allow us to start to collect information for people, for example, at the community testing sites that the National Guard is doing electronically rather than on paper records, and increase our efficiency with moving that information forward, as it'll all be electronic rather than paper that has to be transcribed. The other piece that it will allow us to do is to really begin thinking about contact tracing earlier. So if you're filling out the information in that program, it is going to direct you to start to think about who you've been in contact with in case your test is positive. So it really is too late if we're doing contact tracing 3 to 4 or 5 days. Well, not too late, but it's late if we're doing it after your test is taken. We should really be helping people think about, if I have symptoms now and I could be a risk to other people, what should I be doing today to limit my contact with other people while I wait for my test results? So really important information we'll be gathering. We'll be increasing efficiency through it being electronic, and we'll be moving the whole concept of thinking about isolation and quarantine closer to when the test is taken.
Thank you. We'll go next to Tajma Hall with NBC 15.
Hello, thanks for taking my question. So here in Dade County, we're entering phase 1 of reopening today. So what are some important tips you have for people getting back out into the community for the first time in several months?
Well, I would say, Tajma, that it's very similar to what the tips I gave at the end of my remarks. I want everyone to remember that the virus is still out there. I mean, clearly Dane County is opening because they have seen clear indication from their metrics that the rates of the virus are lower. We've done a lot of testing in Dane County, and we've still maintained fairly low rates of virus identification, but that doesn't mean it's absent from the community. So I think being cautious about going out of your home is important. This still doesn't mean everything's fine. It's like it just was in January. You should go on a big shopping spree and then out to dinner and then out for drinks and seeing 100 different friends that you haven't seen since March. I know we all want to do that, but I would be cautious about how many trips you take out of your home. Only go if you need to. I would keep your social circle very small because the fewer interactions you have, the better. I would be diligent about washing your hands and not touching your face. And if you're out in public, wear a facial mask so that you are not spreading virus to other people in case you are in early stages of developing COVID-19. All of these common sense things are what we all need to do even as we begin to open.
Thank you. We'll go next to Todd Richmond with the Associated Press.
Todd here. I saw a report out of Fond du Lac County from the local health department with some concern about the virus being spread, at least in that county, at funerals and at some recent birthday parties and whatnot. Do you have any evidence statewide that funerals have been a particular concern of late with people not following guidelines and those being, more of a risk for spreading the virus than some other events?
I don't have any specific examples of that, and local health departments, because they do the majority of the contact tracing in our state, are more likely to have specific examples linking cases to each other. What I would say in general, however, is the virus spreads when we're close to each other. It spreads through respiratory droplets, and respiratory droplets can generally travel in the air about 6 feet, and that's why we keep saying physical distancing of 6 feet. I know it's hard. You get to see your family, your friends, and especially hard in a circumstance like a funeral where people are grieving, where they want to reach out and hug each other. But last I checked, there's no way to give a hug and stay 6 feet away from each other unless it's a virtual hug. And so I think what's really important for people to remember is if we want to protect each other from this virus, we must maintain that distance, and face masks assist with that. The last thing I'd say is it's really also to remember who is most vulnerable to this virus. While younger people are more likely to get the virus and experience milder symptoms, if you give that to your grandparent who is in their 70s or 80s, their course of the disease is likely to be much tougher. They're much likely to be much sicker and much more likely to pass away from the disease. And so we all need to maintain caution as we're out there and think about those who are most vulnerable And that's why we need to take these actions.
We'll go next to Jeremy Janine with Urban Milwaukee.
What level of testing can the Guard maintain and for how long? Maybe that's a question for the Deputy Secretary more than Adjutant on that. Anecdotally, could the testing Wisconsin be official to the Guard?
I'm sorry, could you repeat the question about increased testing?
The state's increased the testing seems like it's being driven alongside the Guard and started working well. How long can that be maintained with their plan to bring up the Guard testing alongside that?
Sure. I think we certainly have seen an increase in testing because of our great partnership with the Wisconsin National Guard, and I'll let General Knapp answer how long that may be going on.
Yeah, so as of right now, we talked about last week, we're on Title 32 orders through the 24th of June, and the governor, along with governors from most of the other states, have requested that extend through 31 July. That being said, we are available and ready to continue testing under state active duty if that were to expire. So as long as the need exists for the Guard to assist in this effort, we'll be here in one of those statuses or another.
And what I would add to that is we also recognize that the pandemic is likely to last a year or two until we get vaccine, and we'll continue to need expanded testing. So part of the funding announced last week is also funding that's being made available in local communities to local health departments, occupational health providers, home care agencies, and health systems to assist them with standing up community testing and testing outside of your traditional healthcare system, so that at some point, if the National Guard is not available to us, we have established systems and processes in counties for expanding testing throughout our state. This will be especially important as we enter the fall, when we will also have influenza present in our community. So lots of people are going to have those symptoms, and we need many places for people to easily get tested.
Thank you. We'll go next to Bob Haig with Wisconsin Radio Network.
Thank you. Wanted to follow up on the DHS goal of testing every resident and staff member at nursing homes and long-term care facilities. Wondering, is that goal still achievable this month, and how the progress is going on that? Thanks.
Great question. This is a very important goal for the reasons I just mentioned earlier about the vulnerability of our fellow citizens who reside in those settings. Want to let you know that we've been reaching out proactively to our skilled nursing facilities throughout the state. Out of the 366 facilities that are skilled nursing facilities in Wisconsin, 266 of them have requested testing supplies from us. Again, many of them are conducting testing within their own facilities. Some of them need assistance from the National Guard, and the National Guard has been responding and assisting some of those facilities with testing. So we're well on our way to achieving that goal.
We'll go next to Jessica Van Egren with Up North News.
Hi, thanks for taking my call. I wanted to follow up on the question that Bob just asked. I think it was about 2, maybe 3 weeks ago now that the president had said that, as Bob stated, that it was a goal to have all residents and staff tested in nursing homes. Is there anything that the state receives from the federal government to help push that goal along?
Well, certainly we have received funding through the CARES Act, and that is an important source of resources that we are using to support this goal in nursing homes throughout the state. So as we notify nursing homes one by one of this recommendation, we offer them free testing kits that are available to them. We've also authorized PPE that we have secured through the State Emergency Operations Center so that if they want to conduct those tests themselves, that their staff members who are collecting the specimens are properly protected. And then, of course, third, as I mentioned, in many cases, the assets of the Wisconsin National Guard are available to assist nursing homes as well. So those are important federal assets that we have received to support this work.
We'll go next to Rachel Glosh with WTMJ.
Hey, just wondering if you're worried about any sort of upticking cases after Memorial Day weekend. We saw plenty of pictures and videos of a lot of people not social distancing, no masks. So just wondering if you're preparing for upticks in that regard.
Well, we are certainly monitoring the spread of this virus at all times, and we've seen those same pictures, and it is a risk. We hope the people who are in close proximity to each other were not harboring COVID-19. And we will continue to monitor. This will be the work of the State Department of Health Services from now until there is a COVID-19 vaccine. Because even if we have periods of time when the virus seems more quiet and we haven't seen as much spread, we know it can come back. And so we don't want to be caught off guard. That's why testing is so very important for even when we're not seeing hundreds of cases like we are today when we test, that we want to keep testing so that if we do start to see the virus increase after a lull, that we are all prepared, that we up our protective factors like the ones I've just mentioned, and that we alert our hospitals to be prepared if more people become ill and need hospital beds. So this is a continuous system of surveillance, and we will continue to monitor in the weeks to come if we see an upsurge from this holiday weekend or from any other event as we move forward in time.
Next, we'll go to Riley Vetterheim with the Wisconsin State Journal.
Hi, thanks for taking the call. We got a sense that there may be a COVID-19 outbreak at Madison Mental Health Facility. Do you have any details on whether that is the case?
I do not.
We'll go next to Casey Nelson with WTAQ.
Hi, thanks again for taking the calls. Community testing is wrapping up in some communities around like Brown County and other areas. What changes kind of come to the role of the National Guard with community testing sites closing, and then kind of just like a 30,000-foot overview of the current situation across the state? Thanks.
Sure. In terms of some of the testing wrapping up around the state, what we're doing is we're redeploying those assets to other parts of the state. So even though we wrapped up in testing in Brown County this last weekend, those test teams will be redeployed to other areas all over the state. Right now we have a long list of communities who've put in requests for our assistance, and we'll be moving through those lists as quickly as we can. So additionally, I mentioned last week that we had started taking some of the teams and breaking them down into squads. So we've taken some of the teams, 3 of them in fact, and broken them down into smaller squads so that they're more deployable and more agile to get out to some more of the long-term care facilities and nursing homes to help meet that requirement.
We'll go next to Danny Maxwell with WKOW-TV.
I was going to ask about Memorial Day, but I guess that kind of was already answered. Thank you for that. So can I just ask about tracking that the DHS is doing since home ended?
Tracking since...
Can you repeat the question, Danny? Sorry, there was an audio message. Something disrupted your question.
Sure. I just wanted to ask about how, tracking since Safer at Home ended.
Sure. And again, as we've as I've indicated, we are in a continuous phase of tracking for the incidence of the disease. And so, we're approaching the 2-week mark since Safer at Home ended. As you've probably seen, if you're watching our results, we've had some amazing levels of testing. Again, thanks to all of the good work that the National Guard is doing and our local communities are doing in requesting those Guard resources. I think people understand the importance of testing to identify the virus in communities. We have seen a fairly steady rate of positive tests, ranging between about 4% and 8% of all tests done in a given day are positive. So obviously, if you do 9,000 tests in a day, your 5% is going to be a lot more than if you only do 5,000 tests in a day. So the actual number will vary from day to day, but the percentage seems to be in that range. We'd like to see that percentage go down even a little more. That would indicate less risk in the communities. The other thing we're watching very closely is the number of COVID-19 hospitalizations. And we've been seeing a slow creep in those COVID-19 hospitalizations across the state. Certainly nothing that would put us in a surge situation with hospitals. We're in regular touch with our hospitals, and they have indicated they're good, but something we want to keep an eye on as well, too. So, and as you know, we also monitor symptoms of COVID-19 presenting in our emergency rooms. Another early warning symptom or signal if we're seeing symptoms of the disease presenting in our healthcare system. The last thing that we'll also want to pay close attention to as we begin to open up is when we have positive cases of COVID-19, how many contacts do they have? Clearly, we've seen with Safer at Home, people have had fewer contacts. We know as we open up, people will have more contacts, but that's why we're really encouraging people not to go crazy with going out and seeing everyone you've missed until we've had a little bit of time to see how things are working as we open up bit by bit. Because if you do happen to have either asymptomatic or mild symptoms and you've seen lots of different people, that means you would have been part of spreading this disease much wider and perhaps starting the fire up all over again. So taking those precautions will help us, and we will promise to continue to monitor the state of the disease moving forward so that we can all prepare.
We'll go next to Stephanie Hoff with WisBusiness.com. As a reminder, *6 to unmute your line. We'll move on to Hannah Jewell with Fox 6.
Hi, this is Stephanie Hoff with politics.com. There's a popular housing location on the north side, Midtown, that was just paused, according to Mayor Tom Barrett. A lot of our viewers are wondering why.
Yes, that's a good question. And one of the things that I want to say up front is that we've had this question a couple times today, and the decision to pause a site like Midtown in Milwaukee comes from the local authorities, the county and the city involved. And in terms of the Guard involvement, we're available and ready to reestablish testing or basically restart again whenever the city and county would want us to. So that decision is made at the local level. It's a lot like the requests for assistance. We don't self-deploy as a National Guard, so we deploy only at the request of local authorities. And so that's a good example of how that works in practice.
We'll go next to Stephanie Fryer with WISC TV.
Stephanie Hoff with politics.com.
Go ahead, Steph.
Can you hear me?
Yes.
Okay. Sorry, I have been struggling to start this earlier, but my question is how many National Guard members are in the entire coronavirus response? And then what barriers are there to enacting more citizen soldiers?
So the entire number is over 1,400 right now of National Guard men and women directly operating in response to COVID. And I think the second part was how many more or barriers. Right now, that is the number that we need in order to meet the required missions that are out there. I do have some latitude to activate additional members if we were to need it. Coming back to the testing or specimen collection, one of the long-term goals is to transfer that mission over to local healthcare providers and other people who can administer tests across the state. So for right now, we have the right number, and it's based on the missions and the requests that we have gotten. And I'd like to take this opportunity right now to just reach out and thank all the soldiers and airmen of the National Guard, and especially their families. You cannot underestimate their indomitable spirit in this response to the pandemic. It can't be understated. And we definitely need to recognize that across the state.
Thank you. We will try again for Stephanie Fryer with WISC TV. Then that concludes today's media briefing. As a reminder, you can always access the latest updates on the state's response to COVID-19 by going to the Department of Health Services website. You can also find additional information about the state's response through the websites of the Wisconsin National Guard, Wisconsin Emergency Management, and the Office of Governor Tony Evers. Thank you for joining us today and for your questions.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.